If you're waking up 2, 3, even 4 times every night to pee, you probably think you already know the reason. You tell yourself, it's just age, or my bladder is getting weaker, or maybe, I guess this is my new normal. But what if I told you that frequent night urination is often not what you think it is at all? What if your bladder is just the messenger, and the real story is happening in your heart, your hormones, your sleep, or even your daily habits from the moment you wake up? I'm Dr. Catherin Harris, urologist and bladder health specialist. And in this video, I want to walk you through what frequent night urination is actually trying to tell you about your body. This is not about scaring you, and it's not about making you obsess over every single trip to the bathroom. It's about understanding the signals, separating myth from reality, and giving you a clear, compassionate roadmap so you can take back your nights, your energy, and your peace of mind. What you're experiencing may be common, but common does not mean nothing can be done. Before we go deeper, I want you to hold on to one simple idea. Waking up at night to urinate is a symptom, not an identity. You are not the person with a weak bladder. You're a person whose body is trying to communicate something. And when you learn how to listen, you gain options, you gain control, you gain hope. This video is purely educational. It cannot replace a consultation with your own doctor, and it's not meant to diagnose you. But it can give you the language, the understanding, and the questions you need to bring to your next appointment so you stop feeling in the dark about what's happening. Let's start by putting a name to what you're going through. In medicine, we call frequent night urination nocturia. That simply means that during your main sleep period, you wake up one or more times specifically because you feel the urge to pee. For many people, the occasional night like that is completely normal. Maybe you had a big glass of water late, or a salty dinner, or a couple of beers. The problem begins when it's happening regularly, your sleep is being broken, and you wake up in the morning exhausted, irritated, and feeling older than you are. When you need to get up more than once most nights of the week, and especially if it's 2 or more times, that's not just an annoyance. That's your body asking for attention. And here's where the big misconception lives. Most people assume nocturia is purely a bladder problem or a prostate problem in men. They picture a tiny shriveled bladder that can't hold anything, or they blame age as if it were a diagnosis. "It's just my age," is one of the phrases I hear most in my clinic. The truth is far more interesting and, honestly, more hopeful. In many cases, your bladder is working exactly as it should. It's doing its job, sending you a clear, urgent signal when it's full enough that you need to empty it. The real reason it's filling at night might have nothing to do with the bladder itself. Think of your body's fluid system, like a city with pipes, storage tanks, and timing systems. Night urination can go wrong in 3 broad ways. First, your body might simply be producing too much urine at night. Second, your bladder might struggle to store urine comfortably, so it signals full much earlier. Third, your sleep might be so fragile or disrupted that every small bladder sensation wakes you up. In many people, more than one of these is happening at the same time. That's why it can feel confusing or random unless someone walks you through it step by step. Let's talk about the first scenario. Your body is making too much urine at night. You can imagine your kidneys as filters that decide how much water stays in your body and how much leaves as urine. They are not doing this alone. Hormones tell them when to conserve water and when to let more go. Normally, your body produces a bit more of a hormone at night that signals, "Hey, we're sleeping. Hold on to water, make less urine." That's one of the reasons most people can get through 6 to 8 hours of sleep without needing to get up multiple times. But if that signal is weaker, missing, or overridden, your kidneys just keep producing. Several things can cause that. If you have uncontrolled diabetes, your blood sugar drags water with it into the urine, making you produce large volumes day and night. If you have heart issues, like heart failure, your body may hold fluid in your legs during the day. The moment you lie down at night, That fluid re-enters your bloodstream, passes through the kidneys, and shows up as more urine in your bladder. Certain medications, especially water pills or diuretics, can also increase urine production. If you take them late in the day, your kidneys may still be very active at night. And in some people, especially as they age, the nighttime hormone that usually tells the kidneys to slow down is simply not doing its job as well. The result is the same. Your bladder keeps filling, you keep waking, and you assume the problem is down there, when in reality, the origin may be in your hormones, your heart, your kidneys, your blood sugar, or your medications. Now let's move to the second scenario, your bladder's storage capacity. Even if your kidneys are producing a normal amount of urine, you can still wake frequently if your bladder can't comfortably hold what it used to. Imagine a container that gets irritated and starts to contract at half capacity. You feel urgency, pressure, or even a burning sensation much sooner than you should. Conditions like overactive bladder, urinary tract infections, bladder inflammation, and in men, an enlarged prostate can all make the bladder empty more often and in smaller amounts. In women, pelvic floor weakness, childbirth, and changes after menopause can affect how well the bladder and urethra stay sealed between trips. If you have an enlarged prostate, the prostate can press against the urethra, the tube carrying urine out, and make it harder for the bladder to push urine through. The bladder compensates by squeezing harder and becoming more irritable over time. Eventually, it sends "I'm full" signals earlier and more often, even when there isn't much urine inside. That's one reason many men with prostate enlargement complain of frequent, small volume trips both day and night. But here's the key. Nocturia, by itself, is not automatically a sign of prostate disease. Many people automatically blame the prostate and miss other causes, and many women experience nocturia without having a prostate at all. So if you're a man, don't assume it's only your prostate. If you're a woman, don't assume that nocturia is just for men or that nothing can be done for you. There's also the third piece of the puzzle, your sleep. For some people, the true starting point is not the bladder or the kidneys, but the quality of their sleep. If you have insomnia, restless sleep, or a condition like sleep apnea, where your breathing repeatedly stops and starts during the night, your sleep becomes much more fragile. Any small signal from the bladder that you would normally sleep through now becomes strong enough to wake you. On top of that, sleep apnea itself can alter hormones and pressure in the chest in a way that encourages more urine production at night. That means some patients are treated for years for their bladder, when the real shift happens the moment their sleep disorder is addressed. So when you say, "I pee all night, my bladder is broken," I want you to hear a different message instead. Your system is trying to tell you something. It might be pointing to your metabolism, your heart, your blood pressure, your sleep, your salt intake, or your fluid habits. That's why the sentence, "frequent night urination," it's not what you think, is more than a catchy title. It's a gentle challenge to open your mind to the bigger picture, because that bigger picture is where real solutions live. Now, let's bring this down to your daily life. Think about how your evenings usually go. Do you tend to drink a lot of water or tea after dinner because you didn't hydrate enough during the day? Do you have coffee after 4 or 5 p.m., or a soda with caffeine, or an energy drink? Do you drink a glass or two of wine or beer most nights? Caffeine and alcohol both act as diuretics, pushing your kidneys to produce more urine. Alcohol also fragments sleep. If you add a salty dinner to that, a pizza, processed snacks, cured meats, or a heavy takeout meal, your body holds more water during the day and then shifts that fluid around at night. The end result is a bladder that keeps refilling long after you've turned off the lights. None of this means you can never enjoy a beverage at night again, but it does mean the timing and type of what you drink matters. Many people are surprised to discover that just moving the majority of their fluid intake earlier in the day, cutting back on caffeine after mid-afternoon, and reducing alcohol during the week can significantly reduce their night bathroom trips. It's not magic, and it doesn't replace medical care when needed, but it is one of the simplest levers you can experiment with. Think of it as giving your kidneys a softer schedule instead of asking them to work overtime at night. Another powerful tool is a bladder and fluid diary. It sounds tedious at first, but it's one of the most eye-opening things you can do. For a few days, usually at least 3, you write down what you drink, roughly how much, and when. You also note when you urinate and, if possible, estimate how much comes out. You don't need lab-grade precision. You just need enough detail to see patterns. Many people notice that they hardly drink during the first half of the day and then suddenly try to catch up in the evening. Others realize they're taking a water pill late in the day that could be shifted earlier with their doctor's approval. Some see that on days with extra salty food or more alcohol, they are up far more at night. When I sit with patients and we look at that diary together, the condition stops being a mysterious curse and starts to look like a pattern we can work with. Of course, not everything can be fixed with a diary and a few lifestyle tweaks. That's why I also want you to be very clear on the red flags, the signs that your frequent night urination needs prompt medical attention. If you see blood in your urine, if your urine looks red, brown, or cola-colored, if you have fever, chills, flank pain in your side or back, burning when you pee, sudden difficulty passing urine at all, or pain in your lower belly or groin, do not ignore that. Those can be signs of infection, stones, blockage, or other urgent problems. If you are suddenly extremely thirsty all the time, losing weight without trying, and peeing large amounts day and night, that could be a warning sign of uncontrolled diabetes. And if your legs are very swollen during the day and you are breathless or wake up short of breath at night, that can suggest heart issues that need immediate evaluation. Frequent night urination can be one piece of a much larger picture, and sometimes that picture is serious. Please also pay attention to how this is affecting your days. Are you dragging yourself through work because you've been up 4 times a night? Are you nodding off during meetings, feeling more irritable with people you love, or making more mistakes than usual? Chronic sleep disruption doesn't just make you tired. It affects mood, memory, hormones, appetite, and even your risk of accidents. So even if all your tests are fine, if your nights are shattered and you feel like a zombie during the day, that is still a very real health problem that deserves attention. You do not need to wait until something catastrophic shows up to ask for help. Now, what actually happens when you bring this up to your doctor? You might be worried they'll shrug it off, or you might feel embarrassed. I want you to walk in feeling prepared and confident. First, share how many times a night you usually get up to pee, and for how long this has been happening. Mention whether you make large or small amounts each time. Tell them if you've noticed swelling in your legs, burning, blood, pain, or any other urinary symptoms like urgency, leakage, or a weak stream. Also mention all medications you take, including over-the-counter ones and herbal supplements, and what time of day you usually take them. If you've been able to keep a fluid and bladder diary, bring it. That single step can dramatically improve the quality of the conversation. Your doctor may order a urine test to look for infection, blood, sugar, or protein. They might check your blood pressure, blood sugar, kidney function, and in men, they may examine the prostate. They may ask about snoring, gasping, or choking during sleep, and about your weight and neck circumference if they suspect sleep apnea. None of this is about labeling you. It's about narrowing down which of those 3 problem zones, urine production, bladder storage, or sleep, is playing the biggest role for you. When that becomes clearer, the treatment plan becomes less random and more tailored. Alongside any medical evaluation, there are practical steps you can start experimenting with right away, with your doctor's blessing. You can shift most of your fluid intake earlier in the day and gently reduce how much you drink 2 to 3 hours before bedtime. You can limit caffeine to the morning and early afternoon and swap late-day coffee or soda for non-caffeinated options if you enjoy something warm at night. You can reduce alcohol, especially in the evenings, and be mindful of very salty meals at night that pull more water into your bloodstream later. You can make sure you empty your bladder fully before bed and take a moment to relax so your pelvic floor muscles aren't clenched when you urinate. If you have mobility issues, making the path to the bathroom safer and clearer can also reduce anxiety and sleep disruption. A nightlight, a clear path without clutter, and if needed, a bedside commode for those with limited mobility can ease the mental stress of waking up needing to pee. The less anxious you feel about making it, the calmer your nervous system stays, which can in turn make your bladder a bit less reactive. If you suspect pelvic floor issues, perhaps you feel a heaviness in the pelvis, or you've had multiple childbirths, your doctor may refer you to a pelvic floor physical therapist. This kind of therapy can do a lot more than most people realize for both urgency and leakage. For some people, medications become an important part of the picture. I'm not going to recommend any specific drug to you here. That has to be a personalized decision with your own doctor, but I can tell you the logic behind them. Some medications help relax the bladder muscle, so it doesn't spasm and signal full at very low volumes. Others help relax or shrink an enlarged prostate to improve urine flow in men. In certain carefully selected cases, doctors might use medications that reduce nighttime urine production. These decisions depend on your age, other health conditions, medications you already take, and what your tests and diary show. The point is not to put everyone on pills. The point is to identify the lever that will make the biggest difference for you with the least risk. I also want to acknowledge the emotional side of all this. It's easy to joke about old people peeing all night, but when you're the one lying awake, watching the clock, calculating how many hours of sleep you might get before the alarm, it's not funny. It can make you feel older, vulnerable, and sometimes even ashamed. You might worry about long trips, staying over at someone else's house, or sharing a bed with a partner because you're constantly getting up. I want you to hear me clearly. Your worth is not defined by how many times you get up to pee. You are not a burden. You are a human being whose body is asking for attention in a way that is extremely common and very often treatable or at least improvable. If you've been dismissing your own experience with phrases like, "it's just aging," I'm inviting you to retire that sentence. Yes, age changes the body, but age is not a diagnosis, and it's not a reason to give up on quality of life. If nocturia is affecting your sleep, your mood, your relationships, or your ability to function during the day, then it matters. And if it matters, it deserves a real conversation and a real plan, not a shrug. So, what can you start doing today, practically, after watching this video? You can start by simply observing without judgment. Over the next 3 days, notice what time you drink, what you drink, when you pee, and roughly how much. Notice how many times you wake up at night, and whether those trips produce a lot of urine or just a few drops. Pay attention to your evening habits: caffeine, alcohol, big salty meals, late-night snacks. Then, gently experiment. Move more of your fluids to earlier in the day. Cut back on late caffeine. Reduce alcohol on weeknights. Eat your larger meal earlier and keep dinner lighter and less salty. Give your body a calm, predictable rhythm. At the same time, make the decision to bring this up with your doctor, not as a side comment at the end of a rushed visit, but as something you start with. You can say something as simple as, "I've been waking up to pee 2 to 4 times every night for months, and it's really affecting my sleep. I brought a diary of my fluids and bathroom visits. Can we talk about what might be causing this?" That sentence signals that this is not just an annoyance for you. It's a real problem you're ready to work on. If your doctor doesn't take it seriously or you feel brushed off, you're allowed to ask again, to seek a second opinion, or to ask for a referral to a urologist or another specialist. You are not being dramatic. Sleep is a pillar of health, and any symptom that repeatedly breaks your sleep deserves careful attention. As we wrap up, I want you to remember 3 core messages. First, frequent night urination is not a random curse. It's a structured symptom that usually has understandable causes. Second, it's often not what you think. It may be less about a weak bladder and more about your hormones, heart, kidneys, sleep, or habits. Third, there is almost always something you can do, from simple lifestyle shifts to targeted medical evaluation and treatment. You don't have to accept shattered sleep as your fate. So the next time you find yourself heading to the bathroom at 2 a.m., 3:30 a.m., and 5 a.m., don't just roll your eyes and tell yourself, I'm just getting old. Instead, think, my body is giving me data. You can ignore that data, or you can use it to start a process of understanding and change. And if this video has given you even one helpful question to ask, or one piece of hope that you're not stuck like this forever, then it's already done an important job. I'm Dr. Catherin Harris. Thank you for spending this time with me. Take care of your nights, and your days will follow. And if frequent night urination has been your quiet struggle, I hope you now see that it's not just in your head, and it's certainly not just your age, it's your body speaking. Now that you know how to listen, the next step is to act gently, patiently, and together with a healthcare professional who will take you seriously.